Good evening. I'm psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now entering its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 260-969-2720. And if you're calling coast to coast, you may dial toll free at 866-969-2720. And if you'd like to text me on the air as we're broadcasting, you can text me at 260-969-2730. That's 2730 for the text. Now, on a fairly regular basis, we're broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I recently received. It reads, "Dear Dr. Fawver, I currently take fish oil, magnesium, and vitamin D for my mental health, along with Wellbutrin and Effexor. Are there any other proven supplements that I could safely take with the rest of my medications to improve my mental health?" Well, the supplement you want to avoid would be St. John's wort. St. John's wort is a monoamine oxidase inhibitor. It's a plant-based antidepressant. It will interact with Wellbutrin and Effexor, so take that one off the table. The ones you might want to consider, you're on the right track with fish oil. Vitamin D is probably at the top of the list. Vitamin D is something many of us should be taking 2,000 units every day. Some people can get by on 5,000 units every day. With vitamin D, you can get a blood level to see if you're at the precise amount. You want to be above about 50 on the level for vitamin D. Fish oil, that's been controversial over the course of time. Omega-3 fatty acids can be helpful for the mood based on some studies out of Japan looking at women who were pregnant and they had less postpartum depression because they had such a high fish oil intake of their diet. You mentioned magnesium. Magnesium, 200 to 400 milligrams at bedtime, can actually improve sleep, might help with the depression. So you're on the right track with those three. Looking at other possibilities, if you have a mutation for folic acid called methylene tetrahydrofolate reductase, MTHFR. MTHFR is an enzyme that breaks down folic acid to L-methylfolate. About a third of the people out there will have a mutation such that they don't break down folic acid very well. And folic acid is a B vitamin. If you don't break folic acid down adequately, you'll have difficulties manufacturing serotonin, norepinephrine, and dopamine. So if you have that genetic mutation, and the only way you would know is if you got genetic testing, L-methylfolate as a supplementation could be helpful for you. People have asked about the other B vitamins. People have gone round and around about vitamin B6, which is pyridoxine, vitamin B12, and vitamin B12, if you have a deficiency in it, it might be helpful for you. Older adults, people over 55 years of age, inherently don't absorb vitamin B12 so well, so they will take a sublingual supplement or maybe get an injection every now and then if they are low on vitamin B12. So a lot of times it comes down to what you might be low on. Now, there are some thoughts that various other supplements might be helpful for people. Saffron, you might have heard about that. It's a Middle Eastern herb, but saffron is something that will enhance serotonin transmission, might give you a little bit more side effects with Effexor, but if you were not taking Effexor, saffron is a supplement that some people will find beneficial for their moods. NAC, N-acetylcysteine, is a supplement that people can take at 600 milligrams twice a day and get benefit. It does tend to have some liver detoxification effects, but it might actually help with the mood because it can help you put up with stuff better. So NAC, 600 milligrams twice a day is a possibility. And that's if you don't have a sulfa allergy, because it does have a component of sulfa in it. And if you have a sulfa allergy, you cannot take NAC, N-acetylcysteine. Another supplement people sometimes will take, especially if you're taking a statin. That's a lipid-lowering medication. A statin sometimes will inhibit the benefits of coenzyme Q10, and the active byproduct of coenzyme Q10 is ubiquinol. Ubiquinol, 100 milligrams every day, especially for older adults, can be helpful, especially if they're taking a statin. So if you're taking a statin for lowering lipids, sometimes that can make you more depressed and give you difficulty with mental clarity. The reason behind that would be because statins can inhibit the benefits of coenzyme Q10. Q10, which we all naturally will have. But if you can't adequately metabolize coenzyme Q10, as many older adults can't, that's where ubiquinol can be helpful at 100 milligrams a day. Those are some of the supplements that can be helpful, but you're on the right track with that combination of fish oil, vitamin D, and magnesium. That's a really good start in terms of adding something to the Effexor and Wellbutrin. Thank you for your email question. Let's go to our first caller. Hello, Jeremy. Welcome to Matters of the Mind. Jeremy, you had mentioned that you have attention deficit hyperactivity disorder, and your wife, and you are expecting your first child in July, a boy. Congratulations. What are the odds of that he will have ADHD as well, and what can you do to make sure he doesn't struggle? Well, number one, if you have ADHD, Jeremy, chances are your IQ is higher than normal. I just saw a man earlier today in my practice who had an IQ of 140, and he had ADHD, and he couldn't figure out why he had such a high IQ when he had ADHD, because he couldn't comprehend things so well, and it took him longer to get things done. Well, I said, you know, the average IQ is 100. 140 IQ for somebody with ADHD is not uncommon, because many people with ADHD will have difficulty with inattentiveness, they'll have distractibility, they'll have trouble getting things done, persevering, but they typically will have an IQ 13 to 40 points higher than the average people. So keep in mind that if your son does have ADHD, chances are he can have a higher IQ. What you want to do is consider various options, including being able to tutor him if the ADHD symptoms are problematic for him. Many people with ADHD will have difficulty with paying attention when there's a lot of people around, there's a lot of distractions. So with that in mind, if he can be tutored on a one-to-one basis, many people with ADHD will do much better in that kind of scenario. And keep in mind, Jeremy, that ADHD is it goes on kind of a spectrum of severity, kind of like nearsightedness. Some people have poor vision to the point where they can't see anything. If once they get out of bed, they have to get their eyeglasses on or their corrective lenses on right away. Other people, well, they don't need corrective lenses unless they're looking at a computer, and they need to look at fine print. So people with vision will have different spectrum of difficulty with their vision. The same with ADHD. Some people will have ADHD to such point they have a hard time getting through high school. Other people will have ADHD where it's not highly problematic until they're academically challenged, even to the point of getting to grad school. So the key with ADHD is to determine to what degree it's functionally impairing and try to address that. We're trying not to look at ADHD as necessarily a psychiatric illness as much as it's just a variance of how people are able to process information now. But we want to take advantage of that high IQ and that particular unique nuance of processing information people with ADHD will often have. Yeah, people with ADHD can blurt things out. They can have lack of social tact. They can be difficult to get along with sometimes because they are often thinking 3 sentences ahead of everybody else. But on the other hand, we want to make sure that we're able to address the benefits that they have, because people with ADHD will often think outside the box. And they'll be creative, they'll be entrepreneurs. Some examples, Thomas Edison, Bill Gates, been very open about his ADHD over the years. These are people who are very bright people. They just needed assistance around them to get things done. So with your son, not a big issue. ADHD is about 70 to 90% genetic. It's, as a medical condition, its genetic propensity is only second to psoriasis. So psoriasis is a skin condition. ADHD is number 2 in terms of genetic conditions that are from a medical perspective. ADHD is about as genetic as height. So you know how genetic height will often be. That's kind of where genetically people with ADHD will be. So with your son, yeah, just keep watch over him over the course of time. If he's struggling in school, there are treatments for ADHD of various types, and it's not unlike getting treated for poor vision. If you have tooth malalignment, how do you treat that? You treat it with braces, and the braces often will be time limited. With some ADHD treatments, that will be as well, because in school settings, people sometimes will have difficulty with ADHD symptoms, whereas when they're working individually or they're in a different setting that's new, challenging, exciting, they won't have the difficulty with ADHD. Thanks for your call. Let's go to our next caller. Hello, Luann. Welcome to Matters of the Mind. Luann, you want to know the similarities and differences between schizoaffective disorder and bipolar disorder. Schizoaffective disorder, Luann, is where you have the symptoms of schizophrenia day by day by day. It's a lifelong condition. The symptoms of schizophrenia can be difficulty with processing information, difficulty picking up social cues. You have trouble with social anxiety. You'll have trouble on occasion with hearing voices outside of your head, inside your head, but the voices are not heard by other people, and you can hear, and you can have difficulty with delusions, which are fixed false beliefs. Fixed false beliefs being fixed, you can't talk anybody out of them, and they're obviously false. People with schizophrenia will often have processing of their thoughts such that they kind of go all over the place with their thought processing itself, and they often will have a lot of difficulty with social interactions. So that's schizophrenia. Schizoaffective disorder is bipolar disorder on top of schizophrenia. So schizoaffective disorder means that you have day-to-day symptoms of schizophrenia, but on top of that, you have manic highs that might last for several days where you don't need to sleep, you're impulsive, you have racing thoughts, you have difficulty with doing things and saying things you ordinarily wouldn't do or say. So those are manic highs. Then you may have depressive lows where you have deep, dark depressions where you don't enjoy things. You get more depressed than you ordinarily would be. You feel fatigued. You can't concentrate. And you might have a sense of gloom and doom that ordinarily wouldn't be there. So schizoaffective disorder is schizophrenia day by day with periodic highs, periodic lows. Bipolar disorder just refers to the highs and lows. Bipolar disorder, bi refers to two. Polar means one extreme or the other. So bipolar disorder means that you'll have the manic highs lasting anywhere between 1 day and over 7 days. If the manic highs last for over 7 days and they're impairing in your day-to-day life, that's called bipolar disorder type 1. If the manic highs are not so impairing and they're only lasting 4 to 6 days, that's bipolar disorder type 2. Cyclothymia will be a few days high, a few days low, not highly impairing, but it's there. That's cyclothymia. And then you can have major depressive disorder with mixed features. That's where you have at least 2 weeks of depressive episodes, but 1 day or 2 days, maybe 3 days here and there, every 2-3 weeks or so of having little bitty highs. So major depressive disorder is where you have predominantly depressive mood, but you'll have these little spectrum of little highs that pop in there every now and then. Other people notice them, you notice them, but they're not highly functionally impairing, but they're there. So there's different types of bipolar disorder itself. Hope that helped out. Thanks for your call. Let's go to our next caller. Hello, Joel. Welcome to Matters of the Mind. Joel, you want to know, are there tests that you can take or send away for that can tell you what medications might be effective at a genetic level? Joel, I've never met any genetics that I didn't like because I can always find some benefits from some genetics. And if genetic testing was free, I would do it on every single person I'd see. But you don't want to promise what the benefits of genetic testing might be, Joel, because genetic testing, number one, the benefits can be, number one, it can tell you if you have that methylene tetrahydrofolate reductase mutation, MTHFR mutation. That's the mutation that tells you if you are metabolizing folic acid adequately. And if you think of MTHFR as an enzyme, it's like the turnstile outside of a big stadium, okay? If you think about the people outside the stadium, they're like folic acid. They're trying to get into the stadium. Well, they got to go through a turnstile. That's MTHFR. And once they get in, they're L-methylfolate. So if you get about 25-30% of people who don't have adequate MTHFR functioning, those are the people who need the supplementation of L-methylfolate. So number one, genetic testing can determine who needs L-methylfolate and who does not. Secondly, with genetic testing, you can determine right up front who's going to be at higher risk for a rash from lamotrigine. Now, lamotrigine is also known as Lamictal. It's an anti-seizure medication. It came out in the 1980s, but we've been using it extensively for the purpose of mood stabilization, stress resilience. It helps people put up with stuff. So lamotrigine is something that can cause a rash in about 1 out of 4,000 people. People who are Asian descent have a higher likelihood. So 1 out of 4,000 people in general have this propensity toward having a rash from lamotrigine. Genetic testing can see who's more likely to have a rash from lamotrigine and who's not. So that's another benefit of genetic testing. A third benefit of genetic testing can tell you, it can be that you can give you an idea if you need a high dosage or a low dosage on various medications. Now, the misconception about genetic testing, especially with some genetic tests, is that genetic testing will convey that if you're not a fast metabolizer and if you're not a slow metabolizer, you're a just right metabolizer on medication, that's the medication that's going to work for you. That's not true at all. That's just the medication you'll be dosed at a usual level, but it doesn't mean the medication is going to work. So the misconception about genetic testing will be if you are a normal metabolizer of medication, those medications are going to work for you. That's not true at all, because if you're a fast metabolizer on a medication, it just means that that medication can still work for you. You just need a higher dosage because you're a fast metabolizer. Other medications, you might be a slow metabolizer, so you just need a higher dosage on, or a lower dosage on those. Because if you're a slow metabolizer, it's going to hang around for a longer period of time. So a low dose for a low metabolizer, a higher dosage for a fast metabolizer. That's kind of how it's all going to work out. So those are called pharmacokinetic genetics. There are some pharmacodynamic genetics that can be predictive if a medication is going to work for a particular condition. There's a SLC6A4 gene that's going to tell us who's going to be probably a better responder to the serotonin reuptake inhibitors such as Prozac, Lexapro, Celexa, Zoloft, Luvox, Paxil. These are medications, they're mainly affecting serotonin. They're very commonly used, but about 1 out of 3 people are going to do well with them. 2 out of 3 people are not. The genetic testing can tell us predictably who's not going to do well with those medications. There's a catechol-O-methyltransferase gene, COMT gene, that comes across as either Val-Met or Met-Met. The people who are Met-Met on COMT often don't do as well on higher doses of dopaminergic medications like Wellbutrin and stimulants. They might need a lower dosage because they're going to be really amped up if they take a usual or a higher dosage of Wellbutrin or the stimulants. So that's somewhat of a predictor, and it's something we'll often examine. So you can look at some of the nuances from a pharmacodynamic standpoint, but the number one reason we'd want to do genetic testing would be looking at to see who needs L-methylfolate. Number 2 would be who's likely to get a rash on lamotrigine if we choose that medication. Number 3, it's going to help us dose the medications right out of the gates, high or low. But quite frankly, if somebody is taking a medication and they're having a whole bunch of side effects, what are we going to do? We're going to decrease the dosage. So we kind of indirectly figure out who's going to be a slow metabolizer by doing that. And finally, there's some genetics that can give us a little bit of an indication on determining which type of medication we might use. But those genetics are often far and few between. We're not going to use them so much. Thanks for your call. Let's go to our next caller. Hello, Tom from Columbia City. Tom, you want to know for a friend, can therapy help with dementia? To some degree, Tom, therapy can be helpful for dementia in terms of helping mainly with a family, because the family needs to be reminded when they're in the presence of their loved one with dementia, they need to have a reminiscing interaction with them. Don't get too upset with them if they can't process information. People with dementia typically will have very good short-term memory. They'll remember what they might have had for lunch an hour or two ago. But they'll eventually start to have trouble with things that happened a day or two ago. So they'll have immediate recall that's not too bad, but the short-term memory from a few hours ago, a few days ago, might start to get worse and worse. However, the last thing to go for people with dementia will be things that happened 20 and 30 years ago. So reminiscing with somebody with dementia can be very, very helpful, and that's why I'll often recommend that if you have a loved one with dementia, you keep family photographs around to help them stimulate different memories from the past and interactions. Always introduce yourself when you come in the room. Point out to them what day it is, what day of the week it is. Have a big clock on the wall. Try to get them into that circadian rhythm where they realize whether it's morning, afternoon, or evening. So the therapy that's done with somebody with dementia will often be for the purpose of helping them reminisce and try to stimulate those memories. When people have dementia, we try to maintain socialization and some types of purposeful, meaningful activity on a day-to-day basis. So purposeful, meaningful activity means they need to do stuff. The last thing you want to do with somebody with dementia is to change their environment from place to place. Often difficult to do because if somebody with dementia goes into a hospital setting, it can be extremely anxiety-provoking for them. When somebody has dementia, you want to keep a very consistent environment. The floor plan needs to be the same. Hopefully the housing needs to be the same, but sometimes they do need to go into supportive housing or assisted living at the least. But you want to try to keep some routine in their day the best you can and make it very predictable. So they need to have very structured lifestyles, something they're going to do on a day-to-day basis, which is not going to be unpredictable for them. So yeah, most of the therapy for somebody with dementia will be with the family members and the caregivers around them. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, is misophonia a psychiatric condition? Misophonia is where you will have a lot of anxiety and difficulty with human sounds, chewing, sniffing. You go into a quiet movie theater and you hear people chomping on their popcorn or they're sucking on their sodas. That will cause a lot of anxiety with people with misophonia. So what's going on with misophonia? Well, misophonia, look at the brain here. The deep under parts of the brain give you what's called the default network. A default network is kind of the network that's in the background of your head when you're not really thinking about a whole lot. You're driving down the interstate. Yeah, you're paying attention to the traffic, but you're kind of off in your own world. Some people call that highway hypnosis. It's simply your default network kicking in. Your default network is always kind of ruminating, is kind of always in the past. It's always generating in the background where it's important for biographical information and just kind of remembering things from the past. So it's kind of always lingering in the background. The default network kicks in to the executive functioning network, which is this outside part of the brain. That's called the executive mode network. The executive mode network is the network of your brain that you use when you're thinking very intently on something. You're not distracted, you're trying to figure out something, you're calculating something, you're strategizing. That's where you're really trying to pay attention. The problem with misophonia will be a couple different things. Number one, your default mode network kicks in to paying attention overly so by basically shifting the gear into your salient network. Your salient network is basically your gear shift that takes you from the default network up to the executive functioning network. So when you have misophonia, you're actually thinking about these other people who are chewing and making these sounds. You're focusing too much on the sounds of these other people, and most of us don't notice it. If we do, it's not bothersome for us because it's kind of in the background overall. So part of the problem is you might have an overactive salient network that's kind of kicking in an exaggerated manner. A second part of misophonia is this little part of the brain called the insula. The insula is that's the thumb part of the brain over here, the temporal lobe. This is the front part of the brain. Insula is right at the back here, the thumb part of the brain. The insula is thought to be overly active as well, and that's the part of the brain that's basically making you aware of what's going on with yourself and other people. So it's thought to be a little bit overactive itself. So is it a psychiatric condition? I don't think so. It will cause anxiety. Misophonia will cause anxiety, but I think it's more of a neurological condition where your brain is a bit overactive than it would ordinarily be. We used to think it was an ear, nose, and throat condition. I don't think so. I don't think it has anything to do structurally with the ear. I think it's more of a neurological condition where certain parts of your brain networks are overactive when they shouldn't be. And the treatments right now, we don't know. We don't know about any specific treatments, but it's getting more and more discussed. Misophonia is something you're going to be hearing about more and more as time goes on. Thanks for your call. Let's go to our next caller. Hello, Bob. Welcome to Matters of the Mind. Bob, you want to know if I ever put people on a methylator? I take it that's a menthol inhaler. No, I don't use that as treatment. Some people will find that aromatic therapy, such as lavender, they'll have all sorts of different aromas they might try that can give people a relaxing effect. From a psychiatric standpoint, there's not a lot of research on that. I treat people myself with depression, anxiety, ADHD, various conditions that are causing them to have a lot of functional impairment. I probably wouldn't use a mentholator or aromatherapy for those people because we have medications that can be very effective for them. Of course, different types of psychotherapy can be effective for specific indications as well. Somebody asked me just this last week if I would use detoxification techniques such as laxatives to help people with mental health issues, and I didn't get a thorough ability to respond to that question. But no, usually detoxification is something that might be done from a gastrointestinal standpoint, but with detoxification, you can get yourself into trouble with interfering with the natural flora of the bacteria of the gut. So if you simply use a lot of detoxifiers, and use a lot of detoxification, that can cause you to have diarrhea, and that can cause you to have disturbances of the flora of the gut, and that can cause you to have a lot of other problems itself. So you have to be careful about the cause and effect about different things. I was also asked recently about the use of heavy metal extractors. We'll keep in mind that magnesium, calcium, zinc, these are heavy metals as well, so you don't want to extract those from the body. So you have to be careful about using full body extractors. And it sounds like, Eric, you have a question about body detoxification for anxiety. I would not recommend that, because with full body detoxification, you have to be careful about the potential side effects with that. Again, if you use means of having a laxative effect and trying to get rid of theoretical toxins from the body, you can get rid of a lot of good bacteria from the gut as well, and that can get you into trouble. So, Eric, I hope that helped out. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne is made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.